Hi guys, welcome back to my YouTube channel. Today we're covering a topic that I get asked all the time, and this is treatment for perimenopause. We're going to compare birth control pills to postmenopausal hormone replacement therapy. When to use which one, what are the benefits and cons of each, and how to decide which one's right for you. If you are interested in this topic, I definitely hope you stick around. If you don't know me, I am Dr. Hirsch, and I now have a private telemedicine practice where I can see patients, and I have a license in many states. That way I can give you one-on-one care and individual advice, although these videos here are intended for a medical education and not direct medical advice. But you know that. I also have a book, Unlock Your Menopause Type, a podcast, and tons of other resources. But let's get into today's question. Now, the reason I believe that so many of you ask me this question over on social media, if you don't already follow me over on Instagram, I'm at Heather Hirsch MD. I let you guys weigh in on a lot of these YouTube topics. I think it's because many of your gynecologists or internists tend to prescribe birth control pills over postmenopausal hormone therapy for perimenopause. And so many of you here on social media, on these channels, that actually I have a tendency to prescribe postmenopausal hormone replacement therapy, and you wonder what this discrepancy is here. So let's start from the beginning and let's talk about birth control pills. Birth control pills, also known as oral contraceptive pills or OCPs, are typically combinations of ethinyl estradiol and norethindrone. Now, there can be some differences in the formulation of the progestin in the birth control pill, but most of them are some combination of ethinyl estradiol and a progestin. These doses are really high, about 10 times higher than postmenopausal doses, because they need to stop you from ovulating. So that's the key. The concentration in that oral dose is really key. Now, women without any form of contraception have an estrogen level that goes like this, up and down and up and down. And that rhythmic up and down and up and down is essentially what causes ovulation. Ovulation is what has helped the species get to where we are today in 2023. Now, if you stop this up and down, you're not going to ovulate eggs, and hence you will not get pregnant. So what OCPs do, that high level of ethinyl estradiol and the progesterone in that pill, give you basically a big straight flat line. That stops you from ovulating, hence stops you from getting pregnant. Now, there actually are a lot of benefits to birth control pills. In that flat line can actually stabilize for many women mood. For example, if you suffer from PMS or severe PMS, which is PMDD, this can be very, very helpful compared to this, up and down, that volatility. This can also help to decrease PMS symptoms that are mild to moderate, like acne, bloating, water retention, migraines, cravings, because of that downswing of estrogen that happens right before your period. Now, in perimenopause, the estrogen becomes really volatile. It goes up, then down, then maybe down for a while, then back up, then down. That volatility is characteristic of perimenopause. So what birth control pills do, they simply override that by giving you a really, good level of that ethinyl estradiol and norethindrone, most commonly. Now, this can be helpful because you are giving your body some estrogen. However, there's a couple key things to know about the use of birth control pills. One, they're oral, so they do carry a risk of blood clots. This is interesting to me because postmenopausal hormone therapy, of which is actually much lower doses, also carries a small risk of blood clot, much lower than the risk of blood clot on birth control pills. But most women are scared to death of blood clot on postmenopausal hormone therapy, even though everyone kind of forgets, and doctors even forget, that birth control pills, something they give out all the time, and something that a lot of women have tried at one point or another, actually carry a higher risk of blood clot. Second, they're oral, and so that just means that you're taking an oral medication. Yes, it goes through your liver. It can cause contraindications with some other medications if you're on anti-seizure medications, antifungal medications, or you have a large medication load, and all those medications are being metabolized in your liver. So they're oral. It can cause nausea, breast tenderness, sometimes bloating, a lot of side effects. And what's difficult about birth control pills versus postmenopausal hormone therapy is because you're getting 2 pills at once, you can't tell if it's the estradiol, the ethinyl estradiol, or the progesterone, the norethindrone or levonorgestrel, that's causing the side effect. Birth control pills have that problem. They're kind of a one-size-fits-all. You get both your ethinyl estradiol and your norethindrone in one oral tab once. If it works, great, but if it doesn't, there's not a whole lot of wiggle room. This next big problem with birth control pills, if they don't work, because they can work for some women, and I'll tell you who are great candidates, but they can also lower your free testosterone even farther. Now, this is why birth control pills can decrease acne. They lower the free testosterone. So that can be a wonderful side effect or benefit if you're in your 20s and you don't want to be walking around your college campus with acne, right? But in your late 40s, if you don't have that much testosterone left, and it's kind of eating up the rest of your free testosterone, that can really lower your libido. Also, it can cause severe vaginal atrophy and vaginal dryness on those birth control pills because the vulvar tissue, the introitus, the external tissue, and the vagina are rich in estrogen and those androgens, i.e. testosterone receptors. And as that testosterone's declining, this can cause more vaginal dryness, painful intercourse, and with that low testosterone, also low libido. All right, I know I haven't painted the best picture, so who's a really good candidate? Well, this tends to work well for 2 groups of women. One, you did great on birth control pills in the past. Maybe use them for a couple years, you use them before your children, etc. And you actually felt really good on them. And early perimenopause. Now, I have a great video here on the difference between early and late perimenopause. And early perimenopause is when your periods really first start to get a little bit wonky, a little bit crazy. Late perimenopause, that's when you're starting to get a period every 2, 3, 4, 5, 6 months. So you can kind of at least tell the difference. It's a clinical diagnosis. So early perimenopause did really well in birth control in the past. This could be a really great option for you. Now, what you've all been waiting for. What about the benefits of using postmenopausal HRT in perimenopause? Well, the benefits here are that you can really tailor and individualize this exactly to the symptoms that you're having. You can do one hormone at a time. You are using lower doses and transdermal doses for the majority of the time. I use oral doses as well for some patients for whom that's going to fit better into their lifestyle. And you can really thrive and feel well. And once you establish a really nice relationship or a really nice regimen with that postmenopausal HRT, you're gonna understand your body really well through the postmenopausal transition. You know, with birth control pills, eventually you will wanna either turn them off, which NAM says the latest you can take them is age 55, or at some point start to transition birth control pills regardless. Now, it's really hard to make a video saying exactly how I treat perimenopause with postmenopausal HRT because it is so individualized, but for some patients, we start with just an estrogen patch. If they're still having periods, but they're having hot flashes, they're having night awakenings from night sweats, we do vaginal estrogen if they're having vaginal dryness. If they're having insomnia, anxiety, inability to fall asleep, that sounds like low progesterone, and we trial progesterone. And then we add to them as symptoms change. So it's really hard to say exactly how I do that. It really, really is individualized. But there are many benefits here. I have so many great videos on perimenopause. In fact, I'll just link my perimenopause playlist if this is you and you want to go down that rabbit hole. I also teach you exactly what you need in my Reclaiming Menopause Masterclass. Link for that's down in the description below. That's another great way to work with me if you're not yet ready for a visit or I'm not in one of your states. Now, the last thing that I always hear is my doctor won't prescribe postmenopausal HRT unless it's been 12 months of no periods. I've even had high profile people tell me this, and To which I say, I truly don't know what to say. There is no reason that postmenopausal HRT cannot be used in perimenopause. In fact, it is safer than birth control pills, maybe by a teeny tiny bit, but still, transdermals reduce the risk of blood clots. But a lot of doctors haven't had training in menopause in general and postmenopausal hormone therapy. And one step farther to that is using postmenopausal hormone therapy in women who are still cycling, i.e. in perimenopause. So in a way, birth control pills, ethinyl estradiol, norethindrone, are really hormone therapy, just as maybe estradiol and prometrium or, Premarin and norethindrone are in postmenopausal doses. It's probably just that your doctor does not have the experience or the confidence to know how to do this. The second thing that can be really confusing for even some of my patients and for many doctors is if you are still bleeding, how do you tell the difference between abnormal bleeding and just perimenopausal bleeding and also adding postmenopausal HRT to that. And that's really where a really smart, knowledgeable, and skilled clinician comes into play. I always have my patients who are still having periods on the right amount of progesterone if they have an intact uterus, or I have them consider placing an IUD. I have a great video here that I will link to because this makes it super, super easy. And if there's a pattern of the bleeding becoming more erratic, abnormal, heavy, change in some weird shape or form that seems out of the range of just crazy bleeding in perimenopause, then sometimes we do a workup with an ultrasound and or biopsy. So I promise you it can be done. There's just not a lot of doctors who know exactly how to do it. All right, guys, I hope that this was so helpful. I know you have a ton of questions on this topic, but truly, I wanted to give you a big overview without seeing each person individually and looking at your symptoms, looking at your medical history. It is really hard to diagnose, but there's so many ways that you can work with me and work with your own doctor. Please consider subscribing to the channel. It's free to do so. You can always change your mind, and all my resources are linked down below for you guys. Thank you so much, and I'll see you next week for a brand new episode.